Okay, if I could describe Kate in a few words.
With 3 words.
Gosh, describing Kate in 3 words.
In 3 words.
I would say she... I was already going to use up 6.
Professional.
Professional.
Firstly, I think she's excellent at her job.
Committed.
Relaxed. She is dedicated.
And one is her dedication, so she's extremely dedicated.
She has an incredible work ethic.
She's certainly very available.
Knowledgeable.
Intelligent.
Very smart.
I think passionate about what she does.
And persistent.
This is so many more than 3.
Friendly.
She is so pleasant.
Well, she's very friendly.
Caring.
Caring, yes.
She's friendly and she knows her stuff.
Very kind.
And kind.
A couple more than 3, sorry, but it's hard.
And I'm going to add one in. She's just a beautiful person.
So my name's Kate Marsh. I'm an accredited practising dietitian and credentialled diabetes educator. I work in private practice in Sydney, in Chatswood. So my decision to become a health professional was inspired by my own diagnosis of diabetes at the age of 10. I was diagnosed with type 1 diabetes, and I guess that's where I learnt what diabetes was and what a dietitian and what a diabetes educator was.
I know Kate because she was referred to me 32 years ago at the age of 10 when she developed type 1 diabetes. So I've known her for the past 32 years, the whole duration of her diabetes.
So people often ask me what it was like to be, when I was first diagnosed, and sometimes it's difficult to think back, but I always say I think at that age you don't necessarily, I guess, take on the whole full implications of what it's going to be like to live with diabetes, and probably it's actually harder on your parents at that age. I think it's changed. Look, the tools we had to manage it, have changed a lot. I know my first blood glucose meter was, the size of a brick, and it took 3 minutes to get a reading. You had to wash it off. Things have changed a lot, and it's certainly got a lot better.
Kate was very sweet and would try and do all the things that we would ask of her regarding her diabetes management. But unfortunately, Kate's type of diabetes is inherently unstable, where half-unit changes or 1 unit changes in insulin doses can cause big up and down swings in the blood glucose levels.
But I still remember, the first injection I had to do when I got home. It took me about half an hour. I sort of sat there waiting, but eventually got through it, and I guess it gradually got easier over time.
Kate had a difficult time with diabetes, but she tried extremely hard. She's inspirational. Now, not only would she take my advice, but she would get onto the net and search medical sites and see if she can find some explanation for her unstable diabetes.
A few, yeah. I guess the other memories, or a lot of it, is around food, because it was a lot more restrictive. Now, these days we get, obviously kids to eat what they want to eat and adjust insulin, but it was very strict, carbohydrate portions and, measuring and weighing everything, and no added sugars and things. I've got memories of some interesting birthday cakes made with liquid artificial sweetener that weren't quite like birthday cakes.
Now, I was delighted when Kate told me late in her high school years that she was going to study nutrition at the University of Sydney, because I thought that she would become an excellent dietitian, and that subsequently has been the case.
Hopefully there's lots of success stories in terms of patients I've seen.
I've been a diabetic since early 1980s, and I've not seen a dietitian before.
I was diagnosed 3 or 4 years after Helen.
Someone in particular comes to mind who's done really well, someone with type 2 diabetes, a man I've seen with type 2 diabetes who's really motivated and really took on making lifestyle changes, managed to lose almost 20 kilos and off all medication as well. And it's just it's fantastic to be able to see people make those kind of changes.
I was very vulnerable. I was not in a very good place. I hadn't had a lot of support, and I'd probably been 8 weeks. I heard about all the horrible things about diabetes, all the side effects, and that's really frightening for a newly diagnosed person to hear. That's terrifying. You know, I have small children, and nobody wants to be told that, you know, that maybe your life's going to be shorter than you had thought it was going to be.
In terms of going into this profession, you know, I really wanted the opportunity to, I guess, use my own knowledge and diagnosis of diabetes to be able to help other people.
I went to my GP just for a normal regular checkup, and something he picked up. He said, "Oh, you might be diabetic. This shouldn't be like this." And yeah, it came out. He said, "Oh, you are officially diabetic." I said, "Anything we can do worse?" I said, "No. Once you get it, you get it." I said, "Oh, is there any way I can do without medicine?" He said, "Oh, I've been telling you you've been overweight, but now you have to take medicine." I said, "Can we try some dietitian or something?"
So I think the biggest challenge working in this area is just, you know, how difficult it is to manage diabetes and living it with it. You have a real understanding of that. So, you know, we can give people all the tools and, you know, and they can take all of those tools and really do all of the right things, but sometimes it's, you know, you still don't get the results.
I've had type 1 diabetes for about 20 or so years, and about 4 years ago I was also diagnosed with neuropathy on top of that, which affects my stomach and digestive system. I was quite sick at the time. I had lost about 10 to 15 kilos in probably a month. I couldn't eat. So it was pretty bad, and it was pretty serious.
And I mean, I work a lot with people with type 1, and we just know how difficult it is, and I guess I find that really frustrating, and it's obviously difficult for them when really they're trying to do everything that they've been told to do and asked to do, and it's still not getting the results that I guess we would all hope for.
We find her advice very, very worthwhile, to the extent that it has changed our eating habits. She isn't in any way threatening, but certainly is problem-oriented.
She's not just as though she's reading from a script. She'll go into detail and make suggestions about things which I personally may have not previously considered.
So I came to Kate, and she reassured me that that doesn't have to be the end of my story, that I'm going to end up with all of that. You know, I came here and she reassured me that, you know, yes, I have to make changes in my life, maybe with my diet, and we need to try and get quite good control with my insulin. But generally, you know, there's no reason why I can't have a full, long, happy life. So I came away with a real sense of it's going to be okay.
So I used to be 83, and now I'm only, for last year or so, I've been only between 60 and 62, sometimes half a kilo here, half a kilo there. I mean, because I have lost weight, and now that my two daughters especially, they've just got into healthy eating habits.
I can't remember how I know Kate or how I found Kate, but I'm just glad that I did. There's not really a strict, okay, you've got this condition, so this is what we do to treat it. It's a lot of working through and experimentation. To experiment with all of that on my own would have been completely overwhelming, not only because I was unwell, but just because there was so much conflicting information out there. So she was my guide to sort of find a way to get me stable and strong again. If you meet Kate, then you know why she makes you feel empowered and confident.
Yeah, so finding out, I guess, that I won the National CDE of the Year was just certainly very exciting, and to be able to, I guess, work in a role where I'm doing something that I really love and I feel like I'm helping people, and then to be recognised for that is really a big honour, particularly being recognised by your peers and patients.
Why is it important that Kate's on board for us? Well, she's an expert, but she also has a heart. We need someone who will deliver that information in a tangible, relevant manner that's easy to absorb, and that's what Kate does. She's brilliant.
I know she gets up very early. She gets a lot of work done before most people probably get out of bed. She's always running multiple projects, and she's very passionate about that. She sits on boards, she writes for magazines, she writes for journals. She's happy to get involved with projects. It's not just a job. It's not just a job. It's actually something she lives with and she's very passionate about.
I've been working with Kate for 4 years. I find working with her quite excellent, really. I mean, she communicates very well with me. She liaises with me either via email or phone regarding any of my patients. I think it's really important to know barriers as healthcare professionals in diabetes, and I think Kate is very good at recognising things, but then she also knows when to call upon me when needed, and I respect that.
I just think it's a credit to Kate that she's been awarded this inaugural CDE of the Year award. I can't think of anyone who deserves it more than she does.
Having worked with her for a while and respecting what she does, I felt that she was definitely somebody that deserved to win the award. I was thrilled when she won it.
The first CDE of the year. Those two. Dr. Kate Marsh.